Hello dear student, I am a nursing tutor in Munisheva Ashram College of Nursing. Today I will demonstrate the procedure of medicine administration.
So, firstly, we will see introduction of medication. Administration of medication is a basic nursing function that involves knowledge and skill. The safe and accurate administration is the most important responsibility of the nurse. Improper administration can cause the harm effect. Some basic point regarding the drugs. First, name the drugs, then classification of drugs, then route and time of administration, then principle of drug action, then dose and medication standards. Now we will see purposes of medication. Drug can be administered for the different purposes. First, diagnostic purpose to identify any disease. Second, prophylaxis purpose to prevent the occurrence of disease. For example, heparin to prevent the thrombosis or antibiotic to prevent the infection. Then, therapeutic purpose to cure the disease.
After the purposes, now we will see the rights of medication administration. First, right patient. Second, right medication. Third, right dose. Fourth, right route. Fifth, right time. Sixth, right documentation. 7. Right client education. 8. Right refuse. 9th, right assessment. And 10th, right to evaluation. Now we will see the different route of drug administration. In that mainly three classification: enteral route, parenteral route and topical route. So firstly we will see about the enteral route. In that mainly four classification: oral, sublingual, buccal and rectal. And second, that is parenteral route of drug administration. In that mainly four classification: intradermal, subcutaneous, intramuscular and intravenous. Now third and last classification, that is topical drug administration. In that four classification: instillation of eye drops, instillation of medication into ears, instilling the medication into nose and local and topical application of the drug or ointment. So first route of drug administration, that is oral. Definition of oral drug administration, that is, it is a method of administering medication to a patient by mouth. The medication may be swallow or may be given through buccal or sublingual. In that first buccal route is the administration of drug via buccal mucosa lining of cheek to systematic circulation is defined as buccal delivery. The buccal mucosa lies in the inner cheek and it is used to treat the locally or systematically. And second, that is sublingual drug delivery. In the sublingual drug delivery, where the administration of drug via sublingual mucosa to the systematic circulation. Sublingual mucosa is the membrane of ventral surface of tongue and floor of the mouth. A tray containing for oral medication, scissor for cutting the medicine, spoon to give the medicine, prescribed medicine, liquid form of medicine if prescribed, bowl of cotton gauze, measuring cup to measure the liquid form of medicine, medication card, a glass of water with the cover, paper bag or kidney tray. After tray containing, now we will see the steps of procedure of oral medication. In that firstly pre-procedure steps. So greet the client and explain the whole procedure to the client. Then assess the condition of the client and check the level of consciousness. Now check the medication card with the physician written order for accuracy and completeness. Then check the medication for 3 times. First check of medication administration and also check the 10 rights of medication: right patient, right drug, right dose, right route, right time, right documentation, right to refuse, right education, right assessment and right evaluation. After that second step, that is intra procedure steps. In that firstly we will do a hand washing. So firstly wet your hand Then take adequate amount of antiseptic solution. Now perform the step of hand washing. First, palm to palm. Second, back of the palm. Third, interlock the finger. Fourth, back of knuckles. Fifth, base of thumb. Sixth, fingertips. And last, 7, wrist. Now rinse the hand. Then turn off water by using the elbow and dry hands thoroughly from finger to wrist and forearm in the air. After the completion of hand washing, we will prepare the medication. Provide sips of water to the client for moist the mouth. Then third, check of medication administration with the check the 10 rights. I explain to the patient the medication to be given and clarify the doubts of the client. Then be ensure that patient is always in sitting and side lying position while we administrate the oral medication. Administer only one drug at a time. After that, take the tablet and capsule and pour the required number of tablet and capsule in the medicine cup. And with the use of spoon, given the medicine to the client mouth. After that, offer a glass of water to swallow the medicine. Stay with the patient until each tablet is swallowed. Then, if the tablets is fall on the floor, discard it and give the another tablet. At last, post-procedure step that first replace the article and dispose of according to biomedical waste management and hand wash. Then record the medication with the dose, route, frequency, action, date, time and signature. After the oral route, we will see the installation of eye drops. So, definition of eye drops, that is, it is the administration of eye drops into the eyes for diagnosis and treating the pathological condition of the eyes. Tray containing for eye installation, a bowl of sterile water, bowl of sterile cotton swab or cotton balls, prescribed medication or eye drops, medication card, sterile gloves, kidney tray or paper bag. After the tray containing, we will see the steps of procedure of eye installation. In that, firstly, pre-procedure step. So, greet the client and identify the right client by the ID belt or by name. Then, explain the procedure to the client and prepare the client for the procedure. Then, follow the 10 rights of giving the medication. Check the medication properly and match with the physician order. Then check the expiry date, number of drops and frequency of installation of medication and eye to be treated, which is right eye or left eye. After that, assist the client to desired position, which is sitting or lying with the head slightly hyperextended. Place the pillow below the neck and head to be hyperextended. After that, we will perform the hand washing to reduce the spread of microorganisms. After hand washing, we will perform the intra-procedure steps. So, firstly, done the sterile gloves. Now, use the sterile cotton swab and immerse in a sterile normal saline. Now, wipe from inner canthus through outer canthus of the eye. Use one stroke for one eye. Now, take the medicine or eye drops and instruct the client to look up to the ceiling. Then, expose the lower conjunctival sac by placing the thumb or finger of your non-dominant hand. Then, instill the correct number of drops into the lower conjunctiva and holding it 1 to 2 cm above the eye. Now, take the cotton ball and wipe off the excess ointment or drug from the eyelashes after the installation of the drops. Now, provide the comfortable position and relieve the client from hyperextended position. Now the last step, that is post procedure step, dispose of soil supplies according to biomedical waste management and wash your hand. Then record the medication with the dose, route, frequency, action, date, time and signature. After the procedure of eye installation, now we will see the procedure of ear installation. So, definition of ear installation, it is the process by which a liquid is administered into the ear cavity drop by drop. A tray containing for ear installation. In that, first bowl of sterile water, ear drops, whichever prescribed by doctor, bowl of sterile cotton swab or cotton balls, sterile gloves, kidney tray or paper bag or medicine card. After tray containing, we will start the step of procedure. So firstly, pre-procedure step. So greet the client and identify the right client by the ID belt and by name. Then explain the procedure to the client. Check the physician order for name, dose, time, amount and year to be treated. And also assess for allergy to medication and redness or abrasion in the pinna or meatus. Now provide the comfortable position and side lying position to the patient with the ear being treated, which is uppermost. After that, perform the hand washing to reduce the spread of infection. After the hand washing, run the sterile gloves. Now, take the sterile cotton swab and immerse in a sterile normal saline and wipe from meatus of the ear canal. It is necessary to remove any discharge before the installation of the drops. Now, take the ear drop and to straighten the auditory canal, pull the pinna upward and backward and install the correct number of drops along the side of ear canal by holding the dropper 1 cm above ear canal. After that, insert a small piece of cotton ball loosely at the meatus of auditory canal and instruct the patient to remain in side lying position for about 5 minutes. Then assess the patient comfort and check the discharge or drainage from the ear. And at last, post-procedure steps, make the patient comfortable, assess the patient response, and take all articles to the utility room and replace the medication. Wash the hand thoroughly and document the administration, medication administered, number of drops and patient response, and any discharge coming from the ear. After the procedure of ear installation, now we will see the procedure of nasal installation. So, definition of nasal installation, that is the process by which a medicated liquid is introduced into the nasal cavity, which is drop by drop. A tray containing for administration of nasal drop. So, first prescribe medicine with the dropper, nasal stick or nasal wipes, bowl of sterile cotton swab, sterile gloves, medication card, paper bag or kidney tray. After that, we will start the steps of procedure. So firstly, greet the client and identify the client by his or her name and ID field. Then review the physician order, determine which sinus is affected by the referring to medical record. Check the medication properly by the 10 rights. Now provide the comfortable position. For assess the posterior pharynx, tilt the patient head backward. Position allow medication to drain into the affected sinus. Now perform the hand washing and done the sterile gloving to prevent the cross infection. Now take the cotton stick and inspect the condition of nose and sinus. After that, take the nose drop and discard the first drop to prevent the contamination. For installation, hold the dropper 1 cm above nares and install the prescribed number of drops toward the midline of ethmoid bone of nasal mucosa. Advise the client to remain in a supine position for 5 minutes. For post-procedure steps, make the patient comfortable. Take all articles to the utility room and clean them. Perform the hand washing thoroughly. Record and report observations and the care given to the patient with the date, time and signature. After the procedure of nasal installation, now we will see the topical route of drug application. So, definition of topical application: it is the application of medication locally to the skin or mucous membrane in the form of lotion, ointment and cream. A tray containing for topical route of drug administration. So first, bowl of sterile water, bowl of cotton balls, prescribed ointment, medication card, small towel for clean the area, Macintosh to prevent the soiling of linen, pad or adhesive tape if required, soap with soap dish to clean the area, then sterile gloves, kidney tray or paper bag. After tray containing, start the steps of procedure. Firstly, pre-procedure step, identify the client and explain the procedure to the client. Now check the physician order for the medicine to be applied. Perform the 7 rights of the medicine. The label on the medicine must be checked for a name, dose and route and compare with the patient chart for 3 different times, that is when the medication is taken out from the drawer, when the medication is begin to pour and when the medication being put away or at the bedside. Before start the procedure, provide the comfortable position to the client and expose only the area where lotion to be applied. Now take the Macintosh and place under the exposed area. After pre-preparation of the client, we will go for a hand washing. After that, done a sterile gloving. Now take the cotton balls and wash, rinse and dry the affected area with the soap and water. Take a 1 cotton for 1 strokes. Now take the prescribed medicine over the non-dominant hand and apply on the affected area. Let the patient know that the initial application may feel cold and apply the medication using long even stroke that follow the direction of the hair. Now take the pad and cover the affected area. And with the use of the bandage, cover the whole pad. After applying a bandage, fix it with the adhesive tape. Ensure that the bandage will not too tight. After that, remove the Macintosh under the hand and provide the comfortable position to the client. And at last, post-procedure steps: make the patient comfortable in a bed. And replace the article in a utility room and hand wash thoroughly. Now record the of medication applied with the date and time of application along with any significant findings. So here topical route of drug administration is completed. Now we will see the parenteral route of drug administration. So in that mainly four types: intradermal, subcutaneous, intramuscular and intravenous injection. So firstly we will see the intradermal injection. Intradermal injection are given for the skin testing, for example tuberculin screening and allergic test. The intradermal site should be free of lesions and relatively hairless. Now we will see what is the meaning of intradermal. Intra means between the skin layer and dermal, that means the injection is administered just under the epidermis or into the dermis layer. The syringe is positioned at the 15-degree angle whenever we apply the intradermal injection, and amount of volume whichever we given, that is small, usually the 0.01 to 0.05 ml, because the small tissue space over there. Now we will see the correct techniques of intradermal injection. So first, tip of the needle can be seen directly beneath the surface of the skin. Second, resistance should be felt when the medication is injected. And third, tense white wheel 5 to 10 mm of diameter appear at the point of the needle or as a bulging of the skin. The sites of intradermal injection, that is usually the palmar side of the forearm or anterior aspect of forearm. Then deltoid region for the BCG vaccination in neonate. Then upper chest and upper back. Now we will see a tray containing for intradermal injection, tuberculin syringe which is 1 ml with the pre-attached 26 to 30 gauge needle, a sterile bowl of alcohol swab, a sterile bowl of dry cotton swab, medication for skin test, clean gloves, patient document chart or medication chart, paper bag or kidney tray, and pen or marker to marking the area. Now take the sterile tray or injection tray and place the medicine into the sterile tray. Before placing it, clean the head of the valve with the alcohol cotton swab and with the dry cotton swab. Now take the medicine or syringe and without touching the inner aspect of syringe, place it into the sterile tray. After preparation of sterile tray, now we will start the steps of procedure. Firstly, pre-procedure steps. So firstly, greet the client and explain the whole procedure to the client. Then provide the comfortable position to the client and expose the area or forearm where the injection is to be administered. After provide the position, now we will check the physician order for medication administered and identify the right patient, right dose, right route and right time, and also check the any known allergic history to the medicine. After that, now we will start the intra-procedure steps. So firstly perform the hand washing to prevent the contamination. Then don sterile gloves and select the site of injection and clean it with the alcohol swab. Then prepare the medication, refill the injection with the medicine. Now place the needle almost the flat against the patient's skin around the 15-degree angle and insert the needle slowly into the skin so that the point of the needle can be seen through the skin. And inject the medicine and notice the injection site a bulb resembling over the skin. Then withdraw the needle and apply the sterile cotton over the site. Do not massage the site. Draw the circle around the perimeter of injection site with the pen. At last, post-procedure steps. So in that, discard the used and replace the unused article. Do not recap the needle and remove the disposable gloves and wash hand. Now maintain the record and report for any undesirable effect for the medication and stay with the client for observe the allergic reaction. Now second procedure, that is subcutaneous injection. Definition of subcutaneous injection. A subcutaneous injection is administered into the subcutis, the layer of the skin directly below the dermis and epidermis, collectively referred as to a cutis. Subcutaneous injections are highly effective in administering such medication as insulin, heparin and morphine. Administration site include abdomen, anterior thigh and fat pad over the deltoid muscles in the upper arm. Tray containing for subcutaneous injection, sterile syringe which is 1 ml with the needle, sterile bowl of cotton swab, sterile bowl of dry swab, prescribed medication, gloves, medication chart, paper bag or kidney tray. After tray containing, now we will start the steps of procedure. So firstly greet the client and explain the whole procedure to the client. Check the physician order for medication prescription. Then assess the preparation of the medication, vial or ampule. Then check the 10 rights of medication administration, that is right patient, right drug, right dose, right route, right time, right techniques. After that, place the patient in comfortable position and provide the privacy. And select the site of injection. Preparation of site, we will go for the hand washing. Then don the sterile gloves and select the site of injection and clean it with the spirit swab. Now prepare for the injection, remove the needle guard and express any air bubble from the syringe. With the dominant hand, hold the syringe like pencil between thumb and finger. Now pinch the subcutaneous tissue between the thumb and forefinger with non-dominant hand for incision of the needle. Needle should be inserted at 45 degree. Then remove the needle and press slightly with the dry swab. Don't massage the site which damage the underlying tissue. Now provide the proper position to the client. And now we will perform last step, that is post procedure step. Discard the all articles in the utility room and wash your hand and maintain the record and report. Observe for any side effect and effectiveness of medication. Now we will learn about the intramuscular injection. Firstly, definition. An intramuscular injection is a shot where the needle goes into the muscle layer under the skin in order to deliver medicine. Usually more rapid effect of drug than the subcutaneous route. Now we see what is the site for the injecting intramuscular injection. So there should be a large skeletal muscles like deltoid, gluteus or rector femoris. A tray containing for intramuscular injection, sterile syringe, sterile needle, prescribed medication, distilled water, a sterile bowl with a cotton swab, a sterile bowl of dry swab, sterile gloves, medication card, paper bag or kidney tray. Take another tray, sterile tray or injection tray. Now, firstly, the needle and put into the sterile tray without touching the inner part. Then take the sterile water or distilled water, open it. Now take the medicine valve, clean it with the spirit swab from center to peripheral and also clean from dry swab. Now take the another disposable syringe or dissolve the injection with the normal saline or distilled water. Now withdraw the required amount of the distilled water and push into the powder injection valve. Now dissolve the powder medicine by rotating the valve in both palms instead of shaking the valve from up and down. Then withdraw the required amount of inserting needle into the valve through rubber stopper. Expel any air bubble from the syringe. For preparation, we will start the steps of procedure. So firstly, greet the client and explain the procedure to the client to gain the cooperation. Then check the physician order for medication prescription. Check the 10 rights of medication administration, including the expiry date and any alteration in the color and consistency of the drug. Now calculate the prescribed dose to be administered. Then provide the comfortable position and maintain the privacy. Open the site to be injected. Now start the intra-procedural steps. So firstly, hand washing. After hand washing, done the sterile gloves and clean the site with the antiseptic swab from center to outward in circular motion. Then remove the needle cover. Hold the syringe correctly between the thumb and forefinger of the non-dominant hand. Inject the needle quickly at 90-degree angle. Grasp the lower end of the syringe. Do not move the syringe. Then remove the non-dominant hand. Quickly withdraw the needle and apply pressure on antiseptic swab or do gentle massage. Now assist the patient for comfortable position. Post-procedure step. Discard the articles in utility room. Discard the uncapped needle in needle cutter. Then record the procedure in medication card. Monitor for the localized redness, swelling and bleeding for inflammation at injection site. Observe it for 15 minutes. Now we learn about the IV injection, that means intravenous injection. Firstly, definition. Intravenous injection is defined as an injection made into the vein when rapid absorption is there, when the fluid cannot be taken by mouth, or when the substance to be administered is too irritating to be injected into the skin or muscles. There is a different site of giving the IV injections. A tray containing for intravenous injection, sterile syringe, sterile needle, prescribed medication, valve or ampule, distilled water or sterile water,
bowl of cotton swab, which is spirit or alcohol swab, bowl of dry swab, sterile gloves, medication card, paper bag or kidney tray. Now we will start the steps of procedure of IV injection. In that, firstly, pre-procedure steps. So greet the client and explain the whole procedure to the client to maintain the coordination. Then check the physician order for name of medication, dose, route and time of administration. 3-time checking of the medication for any allergic history and provide the proper comfortable position and expose the area to be injected. Then second, that is intra-procedure steps. In that, firstly go for the hand washing to prevent the contamination. Then wear the gloves and start the procedure. Firstly clean the area with the spirit swab and tapping over the site to clearly seal the vein. Now take the needle and syringe and inject the medicine into the vein. Firstly pull back the syringe plunger to aspirate for a blood return. After noting the blood return, inject the medication slowly over the several minutes. Observe the IV site during the injection for suddenly swelling. Now place the dry cotton over the injection site and gently press it and elevate the hand. Then check the blood is come or not and provide the comfort position to the client. Now the last step, that is aftercare. Replace the article in the utility room and wash your hand. Then maintain the record and report any adverse reaction to nurse in charge or physician. Here the procedure of medical administration is finished. Thank you for watching this video.